how many years could we still continue to follow up the patient and giving some feedback to them that will be, there is no significant changes in the MRI and you are rather stable. So we really need these tools that will be helpful not only for us, but also for the patient as a definite feedback. And indeed, we have done it in the last years, and this revolutionized our management in the everyday visit of the patient. Patients feel much better to see, have a number, to see that they have a total lesion load, which is like 13.2. Now it's 11.8, and they know that they're getting better. And for us, of course, it is also an additional tool. We will not take all the decisions only based on one parameter, but it will be definitely, it has become already definitely one of the main parameters that are used to take treatment decisions in our patients, to understand who is a good responder, who is not. And that's a win-win situation. It helps us and it helps a lot the patients as well.
So for us, first of all, I echo with what you said. I agree completely. For a very long time now, quantitative MRI analyses have been available only for clinical trials. Not only that, the data was actually being used as a measure of efficacy.
Yeah.
That's a small, tiny fraction of the patients with MS. We need this technology to be available for all patients with MS, just as medication is available for most patients. What icometrix has brought us is at a reasonable cost, we can provide a technological level of observation that previously has only been available with the use of special centers with large dedicated research input in funded clinical trials. Now, every patient can be measured this way, can be assessed, and like you, we are using this data, I think, to make important changes in our day-to-day patient management. We now have actionable data from icometrix analyses that ordinarily we wouldn't have. So we've gone back and looked at lesions that clearly are enlarged on icometrix, and our highly trained neuroradiologists, knowing there's been a change, still can't see it.
Yeah.
Because it may be a fraction of 1% around the rim, but if that's on 9 lesions and the whole volume of the lesion, suddenly there's a very substantive volume of tissue that's gotten worse. So this is very, very important. Like you, treatment decisions are increasingly based upon this data, as well as will be a very, very powerful research tool, in my opinion. Research that can be done even at the non-university level, have a better understanding of the comparative efficacy of medications, and also before a patient is clinically sicker, to learn when a medication isn't working well enough so you can make a change before the patient gets clinically worse.
Absolutely.